Chapter 15, Feeding Infants. Prenatal influence. Mother's nutrition during pregnancy has immediate and long-term effects. Overweight mothers means children will be more likely to be overweight as they grow up. Mothers who eat low protein diets and low calories are more likely to have low birth weight, full-term babies weighing less than 5.5 pounds. And you can find more information about this on page 383. Infants of teenage moms are also at high risk. Nutrition must meet the needs of both the mom's growing body plus the infant's growth as well, which causes typical deficiencies such as protein, energy deficiencies, folacin, vitamin B and D. One program that's available in the United States to address these issues in regards to nutrition and prenatal care is the Women, Infants, and Children, or WIC program, which is income-based in order to qualify, and it covers infants to age 5 at nutritional risk, and it provides nutrition, health care, and child care information. Infant growth patterns. Infants experience rapid growth during the first year. Their weight increases by approximately 2/3 of an ounce per day between birth and 6 months, and 1/2 ounce per day between 6 and 12 months. Their length increases by approximately 10 inches, and their basal metabolism rate is higher than an adult's. This is the most rapid growth an individual experiences in their lifetime. Infant nutritional needs are influenced by their rapid growth, their small stomach capacity. Their stomach is about the size of their fist, very small, and their physiological and developmental readiness needs. So part of the rapid growth includes that infants require approximately 45 to 55 calories per pound of body weight during the first 6 months, and 40 to 50 calories per pound are needed during the second 6 months, and you can find out more about this on page 382 of your text. Because of that small stomach capacity, infants are only able to consume small amounts at each feeding, and that's why they have to eat much more often. So physiological and developmental readiness. Their intestines are not fully functional yet when they're born, and so they do not produce the enzyme amylase, which is needed to digest starches that are found in cereals. And that's part of why we wait to start feeding solid food until they have this enzyme to digest it. Their kidneys are not effective in filtering waste products, and this makes infants more prone to dehydration. Also, their tongue reflexes, at birth they're able to suck, and that's a reflective activity, but not to move food from the back of their mouth, from the front of their mouth to the back of their mouth in order to swallow without that sucking motion. So feeding infants. Breast milk or formula provides all the nutrients an infant requires for optimal growth and development during the first 4 to 6 months, with the exception of vitamin D. The American Academy of Pediatrics recommends a daily supplement of 400 IUs of vitamin D for breastfed infants. Formula-fed infants may not require this because most formulas already contain vitamin D. Semi-solid, pureed food should not be introduced before this time. So the advantages of breastfeeding are that it provides the right mix of protein, carbohydrates, and fats, and fats in forms that are easy for the child to digest because it's meant for human infants. It is high in calories to meet the infant's growth and energy needs. It is especially high in calcium, phosphorus, iron, and vitamin C, and it provides friendly bacteria that help the infant's intestines to develop. And also breastfeeding must occur face-to-face and touching, which also is very important in the first 6 months of life. Advantages, again, more advantages for the infant. It provides the infant with temporary protection or antibodies against many viral and bacterial illnesses. And this is an important reason why young women should be immunized, because if you're immunized, for example, against measles, whooping cough, you're going to pass on that immunity to your newborn. Breastfed babies are less likely to have allergic reactions to breast milk than formula. The volume of milk produced is in response to the infant's needs. So mothers and family caregivers are less likely to overfeed a child. It's always ready on demand. You don't have to mix it or heat it. And breastfed infants have shown to have lower rates of obesity. You can also find more information about this on page 385 of your text. Also, breastfeeding is a convenience food. There's no mixing. It's always, for the mother, advantages is there's no mixing. You don't have to worry about the correct temperature. There's no dishes to wash. It's less expensive. There's no formula to purchase. But mothers must increase their dietary intake of certain nutrients and make sure that they're eating enough food so that they can cover their own needs and produce the breast milk. And keep in mind that your body comes first and the breast milk comes second. Also, the conditions are always sanitary, it's always clean, and there's less chance for introduction of harmful bacteria, and it helps to return your reproductive system back to normal and help your body readjust to post-pregnancy states. So the disadvantage for mothers is that it must be pumped or they must be available to feed the baby. It may limit father's involvement in the feeding process. Mother must pay attention to her dietary intake. And again, you can find out more about that on page 385. It requires family support and freedom from anxiety. If a mother is anxious, it might diminish the production of breast milk. And it may not be advisable if mother is ill or taking certain medications. So when a child is in child care, it's really important that teachers and the group care programs support mothers in breastfeeding. Breast milk can be stored in sterile containers and refrigerated at 40 degrees as long as they're used within 48 hours. It can also be frozen at 100 degrees and stored up to 3 months, but it cannot be defrosted and refrozen. And you can find out more information on page 386. You also want to make sure that you label frozen products and even the refrigerated products with the child's name on it and the date it was pumped. So how do we safely handle breast milk? We want to make sure we wash our hands appropriately and thoroughly before handling it. Avoid touching the inside of bottles or caps. Shake the contents and use the oldest milk first. The color and consistency of human milk may vary and fat may separate because it's not homogenized, and that's why it's important to shake breast milk before you feed it. So formula feeding. Commercial formulas are similar in composition to breast milk, but do not contain protective antibodies. Manufacturers have recently added 2 essential fatty acids, DHA and ARA, previously missing from U.S. formulas. Mixing formula with bottled water is recommended to avoid introducing environmental contaminants. So when it comes to educational programs and formula feeding, there are different types of formula. There's ready-to-feed formula, there's concentrated formula, concentrated liquid formula, and then powder. And you can read more about these different types on page 388 of your textbook. So when preparing formula, what's required is to sanitize, making sure you wash your hands using proper methods. You sanitize your utensils, and boiled or bottled water should be used. You also need to be accurate. So when you're preparing formula, you have to sanitize and you have to be accurate, assuring that accurate nutrition and calories for optimal growth and development will be provided. Too much water dilutes nutritional value, and too little water can cause digestive issues and obesity. So you have to be really careful to make sure you're following the directions on the formula packaging. So breast milk versus formula. Both methods adequately meet an infant's nutrient need and provide an opportunity for emotional bonding. Mothers may choose not to nurse or to use a combination of breast and formula feeding based on a variety of factors, including illness or mother's needs to take certain medications, mother's need to be away from the infant for extended periods of time, personal choice, or if the mother is using addictive drugs or a smoker. So when we're talking about feeding infants, we need to make sure that we feed on demand, and that's not an adult preference, but paying attention to what the infant needs. And you can find out more about this on page 388. So you want to make sure that you're clean, you're washing your hands, you're testing the temperature of the formula on your wrist, and you never microwave formula because there's more chance of burning the baby's mouth. During feeding time, it needs to be relaxed with the baby always being held. Never prop a bottle for a baby to feed themselves. Cuddle, maintain eye contact, talk to the baby. This satisfies the baby's need for social and emotional interaction and communication. And it prevents also the baby from choking without our paying attention to that. Tilt the bottle upwards. This will prevent gas. And on page 390, you can take a look at the different sizes and shapes of nipples. Allow 20 minutes for feeding, but watch for cues of finishing. If the baby turns away or starts playing with the nipple or pushing away, that's an indication that they're finished, and don't force them to eat anymore. Burping. Infants naturally swallow air while sucking, and so we need to burp them 2 or 3 times during a feeding to make sure that they're not filling up with air, but they're actually filling up with breast milk or formula. Place upright on shoulder or face down on your lap in order to burp, and regurgitation or vomiting is normal when you burp them. Other feeding issues: water. Breast milk and formula are usually enough until solid food is introduced. But other circumstances that might warrant the need for feeding an infant water would be if it's very, very hot, or if they're sick and they've been vomiting and had diarrhea. Limit the amount that you feed at any one time to 4 ounces. And never sweeten or flavor the water. Just give plain water. Electrolytes provided that you might buy in the store that increases includes nutritional content should only be given to an infant if the doctor recommends it. And so supplements, breastfed babies are going to need vitamin D supplements. No fluoride should be given until 12 months because this discolors teeth and can have toxic effects. And if a child is breastfed longer than 6 months, an iron supplement is needed. In your book, make sure you take a look at page 392. This has a chart that gives you details about age-related eating behaviors, so that you know what to expect when feeding an infant. So how do you determine if an infant's nutrient needs are being met? Well, it's likely that an infant is receiving adequate nutrition if he or she continues to grow. They increase in their length and weight at an appropriate rate. They have energy for active play, and they avoid getting sick often. So, introducing solid food. How do you know when an infant is ready to transition to solid food? They have to be able to accept foods and swallow it. So, swallowing food given on a spoon is different than sucking it from the mom's nipple or the nipple of a bottle. They have to be able to sit up in a chair. They have to be able to assert themselves or turn their head away and push the spoon away when they're no longer hungry. And are they ready to interact and socialize? And do they show interest in touching or picking up foods? And remember, we don't want to start really thinking about this until the child is at least 6 months old. Foods are usually introduced in the following order, and mainly this is because we want to avoid allergic reactions. And we introduce foods one at a time so that you can tell what foods would cause these allergic reactions. So cereal comes first, and rice should be the first one because it's less likely to cause an allergic reaction. And foods, solid foods should never be mixed with formula or breast milk and fed using a bottle. It should always be using a spoon. Vegetables would come next. We want to make sure that we don't introduce fruits before vegetables because fruits are sweet and humans generally prefer sweet to not sweet. And so if we introduce fruits first, then infants will not eat the vegetables. So vegetables first, one at a time, then fruits, and then lastly we're going to introduce meat and other protein. So avoid using honey up until, wait until they're over a year old, and foods containing honey because the honey might contain a botulism spore that humans over age 1 can handle, but infants cannot. This process may be delayed and take longer for some children with special needs. So introducing solid foods can be more of a challenge for special needs children because they may have swallowing difficulties that extend beyond 6 months of age. They may have dental problems or they may have needs for special diets. So feeding precautions. Allergy symptoms, so watch for symptoms like runny nose, wheezing, diarrhea, vomiting, constipation or bloating, and hives and rash. So when you're introducing a new food, give it enough time for those reactions to show up. Most common allergies are cereal products like wheat, oranges, nuts, fish, shellfish, chocolate, and strawberries can be added to that list. Colic usually develops from 3 to 16 weeks, but they usually outgrow colic by 3 to 4 months of age. And so the symptoms of colic include distress, cramping, crying, usually in the afternoon or morning. And if a child is breastfeeding, you'd want to think about mother's diet in regards to the colic, because if mother's eating foods that might cause allergic reactions, like the wheat, oranges, nuts, fish and shellfish, and chocolate, you may have to try cutting out those foods one at a time to see if that's causing the colic. And then we want to avoid putting babies to bed with a bottle, number one, because they'll choke, but also because of baby bottle tooth decay. If they recline or sleep while a bottle or the breast is in their mouth, this prolonged presence of sugar in the mouth can cause tooth decay. Some more precautions. Choking is common during an infant's transition from milk to solid foods, so carefully supervise children who are eating finger foods that we might have them eating at a high chair. Know how to perform the Heimlich maneuver and CPR, and remember that there's special training required for infant CPR. Always cut food into very small pieces. Avoid serving foods that are hard to chew, like raw carrots, celery, or sticky foods like peanut butter, and foods that are difficult to swallow. Avoid serving foods with skins like grapes and hot dogs. Even if you're cutting them in small pieces, they can choke on the skin.